Hi everyone, my name is Rohit Aita, and my topic for the Gardner Fellowship focuses on the state of affairs and ethical implications of IBD genetic testing. So you might ask, what exactly is IBD? As someone with IBD, IBD stands for inflammatory bowel disease. It is typically characterized by an overactive immune response of the digestive tract. As of today, it has no cure and no cause. According to the Crohn's Colitis Foundation, as many as 70,000 new cases appear each year. Some risk factors we understand as of today include diet, vitamin D deficiency, Westernized lifestyle and location, and genetics. There is a clear and present need for better treatment and understanding of IBD. As you might imagine, one of the emerging technologies in IBD research is genetic testing. I subsequently conducted a conceptual literature review on IBD genetic testing on PubMed since 2003, after the completion of the Human Genome Project. I outlined 4 major ideas based on findings from within and outside of the literature review. First of which, direct-to-consumer testing entails the commercial aspect of IBD genetic testing, which has largely been undefined, but 23andMe looks to be a candidate within this realm in the future. Of the existing clinical genetic tests I was able to find, NOT2 and TPMT are 2 single-gene tests, while Dibicol is a multi-gene test. Within clinical research, there are several areas to target, but very early onset IBD is a promising area because in VEO IBD patients who are usually less than 10 years old, genetics tends to be the most likely cause. Last but not least, ethical issues of IBD genetic testing include genetic literacy for patients, as our understanding of IBD is continuously changing, administration in terms of safety and socioeconomic inequities, and reproducibility in terms of efficacy, specificity, and accuracy. Now, genotyping refers to the way in which mutations of genes are identified. 2 popular methods include PCR, or polymerase chain reaction, as identified by the orange category of genes, and next-generation sequencing, or NGS, identified by the green category. Next-generation sequencing, as the name implies, allows us to analyze whole genomes more efficiently and faster. While other methods could be used, so far NGS, in my opinion, holds the most promise for the future. IBD genetic testing can also greatly help increase efficiency of current IBD treatments. So far, biological immunosuppression, thiopurines, and surgery have all been studied in conjunction with one of the IBD genotyping methods. I believe that NGS techniques can help us make better progress to cover other and new treatments. As we try to understand the causes of IBD and hopefully one day find a cure, there are a few policy and ethical considerations to make to ensure optimal patient care. Firstly, I argue for increased regulation from the FDA and USDA of a genetic test's scientific validity and utility within the clinic. Secondly, I argue for increased quality assurance and pre-test and post-test clinical decisions and procedures. Lastly, as we tread carefully into the consumer genetics market, privacy of genetic information is paramount, as we do not fully know the uses and unintended consequences. 23andMe will be the first case of what we need to address. As someone with IBD, I am optimistic that such technology and innovation can help us get closer towards understanding the causes of IBD and hopefully a cure. Thank you for taking the time to listen to my presentation.